Joining us now is Paul Rieckhoff, the founder of Iraq and Afghanistan Veterans of America. He's now the host of Angry Americans, a podcast. Paul, thanks very much for joining us this evening. It's good to see you, my friend. I'm really glad you're able to be here.
Good to see you, my friend. Thank you for all your leadership.
Well, talk to me about how you feel about this VA story. I feel like I do not want to be reductive, and I do not want to think about every VA medical center as being the same as every other. I know that state-run veterans' homes are having different challenges than VA medical facilities, but it strikes me as nuts and increasingly actually just weird that the VA is maintaining this public front that everything's fine, they don't have any shortages, they've got no problems.
Well, it's dangerous and potentially devastating. Here's the big picture. We now know we're a nation at war against the virus. We're a globe against the virus. But here at home, there are two major forces that could add tremendous resources and either be the cavalry or be a deck of cards. The Department of Defense on one side and the Department of Veterans Affairs on the other side. The Department of Veterans Affairs serves 9 million people nationally. You've talked about the resources they bring to bear, and they have a sacred duty to care for our veterans, and that's important. But this time, it's much bigger than that. They are the nation's backstop. So every time I've come on your show for over 10 years, we've talked about VA problems, we've talked about data issues, and it's always affected mostly veterans. Now, it affects you. It affects everyone. Because if your hospital overflows, the VA is tasked nationally to be there to control that overflow. So they haven't been clear, they've been slow, they haven't been transparent, and the bottom line is the VA is not ready. Department of Defense, I would argue, is not ready either. But the VA is not ready, and the Secretary of Veterans Affairs, you touched on it, he wasn't seen in public for over a week. He wasn't just not doing briefings. I mean, he apparently takes Easter off. He's not putting anything out on Twitter. He's totally AWOL. That's why I've used the hashtag #WhereIsWilkie. He should be the lead element on combating the virus and providing support not just for veterans, but for the entire public. And he's been MIA, and that's a failure of leadership that should concern everybody.